Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, my dear listener. This episode is starting a series about breast cancer screening when on hormone therapy. And there will be a few episodes on this topic because there's a lot to say about mammograms. This is a hot topic today. But this is starting a conversation that's broader. And whether you have decided to use hormone therapy for menopause or not, the biological markers and the well-being indicators I want to talk about in the next episodes are crucial because they're overall well-being and wellness markers and very valuable clinical parameters that should be taken into consideration and monitored every time a woman comes into the physician's office for either a routine annual checkup or for an annual follow-up when a woman is using hormone replacement therapy. I guess what I'm trying to say is that this podcast series will target women who use hormone therapy for menopause and after menopause, but every single health indicator that I'm going to talk about in this series is just as valuable and pertinent to discuss and monitor, even if you are not using any hormone therapy. So I'm going to start with breast surveillance because it's one of the most important and significant reasons for hesitation when it comes to starting or not starting hormone replacement therapy for menopause, whether or not there is a perceived risk of breast cancer with it. So I'm going to focus on breast health for the next few episodes and how do we best monitor a woman's breast well-being as she ages, and especially so when she's receiving hormone therapy for menopause. You might say, well, wait a minute. I thought doing an annual mammogram is all that's needed. So why are we talking about this topic, or what in God's name is there to talk so much about this topic? Well, keep listening because I'm going to tell you a lot of things you do not probably know or you haven't heard. There's much more to breast health surveillance than just doing a mammogram. And more so, more and more women are becoming aware of radiation risk for their breast tissue. And they're raising the question and expressing concerns when they come in for their appointments of whether or not an annual mammogram done for 40 years is actually safe. And they're asking, hey, is the amount of radiation that I'm going to receive if I do an annual mammogram for 4 decades, is it safe, and is this something that I really want to do? So when it comes to this topic, I can tell you right off the bat that there are no specific straightforward answers because conventional medicine opinion about whether or not there's a risk of breast cancer by radiating your breasts year after year with an annual mammogram, their stance on this is that there is no risk, and the benefits of finding an early cancer outweigh any possible risk derived from the annual exposure to a very small dose of radiation. Now, in order to present you with some facts and numbers that would make sense to you to help you make a decision about the best method of breast cancer surveillance or breast surveillance in general, I did use an AI search to look for some numbers. My request for the ChatGPT to give me the answer was kind of long. It was a very long question, had a lot of conditions. So it did take AI a while to get back to me as the data came back. So I'm going to present the data just as it was presented to me. So the concern that women express is how risky is an annual mammogram if I'm going to do it for 40 years. If a woman starts screening at age 40 and continues all the way beyond age 80, Now, we're talking 40 years of a very minimum dose of radiation with each annual screening. However, what perhaps many of you do not know is that this minimal dose of radiation, it is minimal, but it is cumulative, meaning you don't get zapped and then it's over and your body recovers. Whatever radiation you get exposed to, the effects sustained by your tissue remain. So after a certain amount of radiation to your breast cells, you will have achieved the maximum threshold for tolerance and repair that's needed in order to reduce and restore the damage created by the exposure to the radiation. At that point, irreversible changes, including cancer, are possible. And more so, at that point, you will be at increased risk of developing breast cancer. So what is the exact risk of breast cancer from repetitive mammograms? Well, we don't know, but there have been modeling studies which suggest that for every 100,000 women undergoing annual screening with a mammogram between the ages of 40 and 74, there will be 125 radiation-induced cancers and 16 deaths. Therefore, the statistics of a risk for a woman to develop breast cancer induced by an annual mammogram exposure over 30 plus years will be somewhere like 1 in 1,000. Very, very small. So there are many advantages to starting screening early as age 40. 10%, and now some statistics actually say 16% of cancers impact women under 50. However, as it turns out, talk about this more later, but I'll mention it here, the breast sensitivity to radiation is heightened when the breast cells are younger. So the risk of radiation-induced changes is higher at younger ages. So maybe radiating breasts from 40 to 50, even though that's the recommended guideline right now, might not be the best idea. Now, here's my question for you, and this is the topic of the podcast today, and possibly a question for the medical community, established standard of care. Here's the question. Our technology has significantly advanced in the past 3 to 4 decades, especially our imaging technology. We now have other imaging techniques of detection outside of mammography, and mammography has been the gold standard of breast cancer detection for the past 40 years. And a few more words about mammography. It has been introduced as a technology to detect breast cancer in the 1960s. Became the standard of care for breast cancer detection and screening in 1986. That is 40 years ago. Since then, there have been major advances in non-invasive and non-radiation exposure technology, breast ultrasound, MRI, thermography, etc. I'm going to review some of them here in today's episode for you, my dear faithful listener. And you're probably asking yourself at this point in time, wait a minute. If not a mammogram, what else is there? So let's talk about the first alternative that most women are highly aware of, and it's called a breast ultrasound. Breast ultrasound technology has come a long way from 2D. We have moved into 3D and 4D. 2D stands for two-dimensional, 3D, three-dimensional, 4D is four-dimensional. So what does that mean? Well, obviously you need to know what it means because choosing the right type of ultrasound is important. So today's podcast is going to present you with just a few simple details about the difference between a 2D and a 3D and a 4D ultrasound of the breast. A 2D ultrasound is presenting a flat, two-dimensional image of the breast tissue. That means it can allow visualization of a single slice of tissue at a time, providing additional detail on top of the mammogram, but it has a limited depth of perception. It is really used to simply evaluate whether an abnormality is a solid nodule or a cystic mass. A 3D ultrasound captures multiple two-dimensional images from different angles and reconstructs them, providing a more comprehensive view of the breast and is helping analyze with more clarity complex lesions. A 4D breast ultrasound establishes the real-time dynamic images of the 3D ultrasound, and it also incorporates the time dimension, allowing for visualization of changing breast tissue. It's capturing tissue movement, blood flow over time, which is very useful in analyzing breast abnormalities, and it can potentially be helpful when it comes to an earlier detection of a tumor. Another alternative option to breast imaging for breast cancer screening is thermography. I guarantee you might have not heard of thermography, or you might have remotely heard, and it's somewhere at the periphery of your awareness, but many women have never heard of thermography. Thermography is based on infrared technology, and instead of detecting abnormal breast tissue appearance, which is what the radiologic view of a mammogram does, instead of detecting distorted tissue due to cancer or abnormal calcifications, which is what mammograms do, it focuses on whether or not there are hot zones, inflamed, hypervascular area, and that's really important. Why? Because there is no cancer without abundant blood flow and without an overgrowth of blood vessels, without which cancer cannot expand and cannot grow. There are some very significant advantages of thermography over a mammogram. Number one, there's no risk of radiation. And many women are completely willing to pay out of their pocket to have a thermogram because they wish to avoid the risk of radiation and the discomfort. So that's number two advantage. It is non-invasive. No one has to manhandle you. There's no one touching your breasts. No one is squeezing your breasts, pulling them and arranging them over a cold surface, and then pressing on them with another cold surface to get a good view. Every time I have a mammogram, even though the person doing it is very nice and very apologetic, I swear I feel like slapping her nonetheless. It just doesn't feel right, and it feels very invasive. And many women feel the same way. Thermography is very advantageous and much better option for women in whom mammograms have limitations. For example, women with dense breasts. That's number three. Or women with very small breasts who have such little tissue, they cannot be squeezed effectively between the two plaques to get an X-ray, which is a mammogram. Women who breastfeed, same thing, they are not good candidates for a mammogram. Or women who are sensitive, who find the mammogram extremely uncomfortable and loathe getting one, would rather do nothing than have a mammogram. So thermography is an excellent alternative option for all of these circumstances. And last but not least, number four advantage. Many proponents and very staunch supporters of this breast imaging technique insist that thermography can pick up changes in blood flow and metabolic activity, which can precede and possibly announce early precancerous changes, which will otherwise go undetected by a mammogram or an ultrasound or an MRI until cancer is actually developed. And a few more words on this very specific advantage of thermograms. The supporter of this technology argue that we will pick up cancer before any other imaging technology and has considerable advantages over the mammogram and the breast ultrasound because of this idea that you cannot find cancer early enough unless you use thermography. Obviously, thermography is not considered standard of care because there's not enough statistical evidence to show that this method of screening and surveillance justifies the cost and the decrease in risk. But there is no risk of radiation, and there are many advantages due to the fact that thermography could provide useful information regarding stagnation of toxins or inflamed areas that will need and should be followed up very closely. And it's indicating the need for addressing systemic issues which are impacting the breast tissue before any cancer happens. So in this respect, and from this point of view, thermography is a true screening technology because it could detect precancerous changes versus the mammogram simply detecting existing cancer. Just it's detecting it early on so that the treatment can be curative. And again, just as a FYI, the definition of a screening technique is very clear. It's a rapid preliminary test or procedure used on asymptomatic individuals or populations to identify those at higher risk of having a specific disease or condition. It's not identifying those that already have the condition. That's a diagnostic test. It acts as an early detection tool and separates individuals who need further diagnostic evaluation from those likely to be healthy. Well, the mammogram simply separates the you have cancer versus you don't have cancer. It's not assessing risk of cancer. So we need better technology. We need better testing. And I'll talk a little bit more about that. I'm going to make a little parenthesis here because I believe it is called for. This is not meant to be a podcast episode about breast cancer. However, it is important to mention that none of the screening surveillance technologies that we have available for breast cancer are doing anything to look into the root cause of breast cancer or detect breast cancer risk, because we don't really know what is the root cause of breast cancer. We do have some strong evidence and data that breast cancer is related to aging, to hormonal disturbances, to exposure to hormone disruptors, to lifestyle issues like excessive alcohol consumption, processed foods, sedentary lifestyle, smoking, exposure to chemicals, etc. And the list can go on and on and on. What I personally like about thermography is the fact that it provides us with the idea that something is actually happening to the breast tissue. It picks up a problem. It can send both the woman and the physician who's taking care of her on a path of discovery of what exactly is causing the abnormal appearance or the hot zone in the breast, which obviously will pop up as bright red on the thermogram. And obviously, once confirmed it is not a malignancy, then it needs to be addressed properly and promptly to prevent the possible malignancy from actually happening. This early detection of a pathological blood flow or an abnormal metabolic process, which is picked up as a hot zone with the color red on the thermogram, is considered a disadvantage by conventional medicine and naysayers of thermograms. And in reality, they fail to realize the potential of detecting early pre-cancerous changes with this. The supporters of mammograms and of conventional breast cancer screening techniques argue that thermography is not sensitive enough to detect real cancer, and it could generate a lot of false positives. Guess what? Women who do thermograms are not looking for cancer. They're looking for, do I have a problem that's going to give me cancer later? I personally like to apply common sense and logic to medical decisions and facts and data interpretation. And if thermography detects early blood flow and metabolic changes, which are not proven to be cancerous yet, that's great. Wouldn't that be an advantage? It would. It could point both the woman and her provider on the path of discovery of what exactly is happening to her breast tissue. Prompt lifestyle changes, detoxification programs, hormone testing, and closer surveillance to ensure a complete resolution of the inflammatory process or the abnormally metabolic process that's picked up on the thermogram. Obviously, all of this will be done after the routine conventional screening techniques, which need to be a follow-up from an abnormal thermogram. After all these techniques have ruled out the possibility of malignancy, at that point, the woman should be relieved. It is a false alarm, but it is an alarm pointing to something happening in the breast. Whereas with the mammograms or the ultrasounds or the MRI, when there is an abnormal finding, it's not pointing you on any kind of path like, hey, we got a problem here, even though this is not cancer and it's a false positive, you got to do something different. And I do believe because of that, thermography needs to be considered and looked at closely by Medicare and medical insurance plans, because it will save probably billions of dollars in expenses if we could detect changes that push women on the path of developing breast cancer early enough so they could intervene and actually be effective. And with more studies and more standardization and interpretation protocols, thermography could become a very, very useful tool. Women seem to prefer it, and there's no radiation and no discomfort. So I will close this parenthesis here. I hope I provided you some food for thought. And I do believe that the powers that be should really consider including thermograms as an approved screening surveillance method for breast cancer, allowing women more choices and more options for early detection, especially as I have seen that there's a trend of women opting out of mammograms lately. Women are really shying away from annual mammograms starting at age 40 and ongoing until the 80s and beyond. When the mammogram was first approved as a screening technique, it was targeting women between the age of 50 and 75. Now that the life expectancy has expanded to 85 and beyond, it's adding another decade to the screening interval, and many organizations have been advocating for breast cancer screening starting as early as age 40 in any woman, including low-risk women, simply based on the fact that 10 to 15% of breast cancers are now happening in women between 40 and 50, with the majority of cancers still detected after the age of 50. What all these supporters for early screening fail to tell women and doctors who are recommended to start screening at such an early age is the very important fact that between the ages of 40 and 50, the breast tissue is denser and the mammogram is much less sensitive in detecting malignancy. Therefore, other screening techniques like ultrasounds or thermograms would be much more suitable. And just a useful tidbit of information regarding the fact that most organizations today, like the American Cancer Society and the U.S. Preventive Services Task Force, including the American College of OBGYN, recommend screening mammograms every 2 years for all women between the ages of 50 and 74, as it is more and more recognized that annual screening increases the risk of false positive results and overdiagnosis. Next week's episode, I'm going to discuss the impact of false positive results and overdiagnosis of breast cancer, so stay tuned. But I'm going to come back, and I don't want to leave you hanging here, but think about the fact that now most organizations recommend screening every other year between 50 and 74 if you're a low-risk, average-risk patient. That means the number of mammograms have been cut down from 25 to 12. I will close here, and I'm going to come back next week and continue what I hope to be a very valuable conversation for you. Because in next week's episode, I'm going to touch on mammogram risks and continue the conversation the week afterwards, talking about how women have been conditioned to believe a mammogram is all they need, when in reality, breast exam is very useful. Breast exam often is discounted by many unnecessary, but I do want to close on this note today that the self-exam every month done by the woman herself and the annual exam a provider does, these are very valuable, simple tools, easy to do, no radiation, no discomfort, will provide very valuable insight in someone's breast health. So please consider doing your own exam once a month and ask your doctor to do an exam once a year. If you ever wondered what annual mammogram risks are, or you never heard of overdiagnosis, and if you wonder why so many women hate mammograms, just join me next week because I will continue this educational series focusing on these topics. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.